You have been one of the medical professionals who's been very vocal from very early on, arguing the government needs to take stronger steps to combat COVID-19. We've just, in this bulletin, been taking our viewers through the very strict measures on self-isolation, on border closures, on quarantine measures that are now being enforced around the country. What's your view on the situation now? Are governments now doing enough?
Well, it's fantastic, and we congratulate the government. We congratulate the Premier for really moving hard now. There's obviously a lot of catch-up because even just a couple of weeks ago we were still encouraging folks to get out and about. So, no, this is great. We really appreciate the community coming along with us. We think that this will buy us the important time we need to get properly equipped on the front line so that we don't have unnecessary deaths of both patients and healthcare workers.
Is it too soon for optimism that infection rates could be slowing, that we look like we have it in us to flatten the curve?
Look, it's fine to be optimistic as long as at the same time you're taking very strong action. We'd like to see more in the way of testing, and we really want to see delivered now. We want to see the boxes that contain the masks that are going to look after our workers so that we don't have any of the sort of gear you're showing there at the moment available to us to even train in right now. All of that has to be done, and if we can buy extra time, it means that we're going to save people's children, people's parents, people's loved ones, and the public themselves. The economy will recover quicker the harder we go now.
Well, we are going to be hearing from the Health Minister in around 40 minutes' time. He has already announced, of course, that a real boost in terms of acquiring protective equipment, acquiring millions of masks and other supplies due to either arrive already in the next couple of days or in the next week or so. How is the morale of our health professionals on the front line at the moment on that front?
Well, we can't dress it up. The morale on the front line is terrible. They feel as though there's not a true understanding at the highest levels of what it is that they're facing out there, particularly in the backup private hospitals. We're slowly closing the gap, and we're just grateful for everything the government does. But we have to see it actually delivered and that training be done, because it's not the matter of the mask just arriving. You then need to train in teams to use it. It's just like any other team situation, like a race car. There's no point just having a racing car. You've got to have a driver and the team to back it up. So we need all of that in place, and every day that we have will make an enormous difference to the death toll that is going to come.
The WA Health Minister hit out at you personally yesterday over the objections you raised on the weekend about cruise ship patients here in Perth. The government had planned to send them to a private hospital. You and others campaigned against that. The decision was then made to send them to a different hospital as a result. The Health Minister, and I quote, says that for a doctors' organisation to openly encourage their members to turn their back on sick people who are in a time of need, he says he thinks it's disgraceful. He says it embarrassed him as a West Australian and as the Minister for Health. Do you regret your calls for members at the private hospitals to refuse essentially to treat those patients?
No, we made absolutely the right call on safety grounds, and that was validated by the Federal Health Minister. As odd, I was criticised by one health minister and praised by the other for the same actions. We really need to be all the same team moving forward. The appropriate facility for those patients was available. That's where they went to. And it's in fact in many cases the same doctors who would have treated them in both, but the doctors said, this is crazy, that facility's not ready, this one over here stands ready. Let's not have political decisions, let's take medical safety decisions so that we can keep the patients and the healthcare workers alive. My understanding is that a number of those patients are critically unwell, and that facility simply had not had the training, it didn't have the gear, and anyone on the front line was quite clear that it was a decision that wasn't based on the patient's best interests.
The cruise ship issue is a big one in WA and also off the coast of New South Wales as well. We know that New South Wales authorities have been speaking today about the fact that these ships are essentially lingering off the coast. If they don't start to head on their way, what is the impact for our hospital system? Are you concerned that we could see a flood of people going into hospitals around the country as a result?
Well, a doctor's point of view is that we treat any human, we don't care where they come from, they just need to be looked after in the best way that we possibly can. They will, of course, set us back if we do have a number of patients that are needing intensive care, as there will be amongst these. We've all learnt, I think, what the cruise ships mean, but it's the government that's allowed these cruise ships to continue to operate since the start of this pandemic, and we have to take full responsibility for these for these patients and for the healthcare workers who are going to be looking after them. And in a situation where we get a lot of extra patients, what that means is we've got to slow it down. And I think we're all starting to see the kind of measures now that are going to be necessary. New Zealand's gone there, the UK's gone there too late, the US has gone there too late. The sooner you do it, the less likely you are to get overwhelmed and start to see unnecessary deaths. So that's what we've been calling for all along, and respectfully we say to all branches of government, get your messages aligned, make it very clear to people that the reason we're doing this is that this disease doesn't just kill the elderly, it also kills all sorts of other age groups and disabilities. And whilst we're seeing lines on the Dole office right now is terrible, that's terrible for people's health, we understand that, but we'll soon have lines of ambulances, lines of ventilators, and we'll soon have lines of people who are very, very unwell, and many of them will not survive. So more will survive if we can get properly kitted up. And to get kitted up, we need time, and to have time, we need you to lock down.
It appears some people around the country are ignoring advice to stay in their primary place of residence and not head to their farm stay or their beach house to wait out the crisis. Just to be very clear on the reasoning that people are being asked to stay in their residence, what impact could we see on rural and regional health providers if there is an influx to some of these areas?
Well, however slow the preparations have been going and however slow the wheels have been turning in the metro regions, it's way behind in the regions. So those regions cannot cope with their usual off-peak population. We saw this in Lombardy in northern Italy, that many of the rich went to their villas and they subsequently died. The regional areas won't be able to rely on being able to move people out the way they normally do when they're critically ill if the cities are swamped with cases. So you can't blame Australians for doing what they want to do. That's what Australians always do, and that was very predictable right from the start. And that's why the mixed messaging around can you go to the footy and the Grand Prix and that sort of thing, even just a couple of weeks ago, has set us back in public education. We know it takes a while for people to absorb the message, and then there will be some who won't absorb it no matter what you do. So we need to just coolly, calmly and patiently explain to people that what this is about is not just the economy, and that the way to solve the economic problem is to solve the health problem. Because if you have a terrible tragedy in your family and you've also lost your job, getting more and more deaths is no way to fix the economic side of things, because that will completely shatter everyone's confidence.
We can all agree on that. The WA AMA President, Andrew Miller, appreciate you joining us.
Always good to talk to you.